legal options for transplantation are essentially two. There's living donation and deceased donation. Deceased donation, a kidney comes from somebody who's died in a car wreck or of a stroke or something like that, and the family, in dealing with the end-of-life decisions, makes the decision whether they want to donate their loved one's organs to individuals that need those organs, like a liver, a kidney, a heart, things like that. Living donation has become much more prevalent recently, primarily because it's a little bit easier now to do the donation procedure. It's done laparoscopically versus an open procedure. And Clarion has taken the lead in this, in making this more available to people, primarily initially through laparoscopic donation. Now it's to the point where about half of our kidneys are from living donors. If you want to donate a kidney, you have to be between the ages of 18 and about 60 to 65. We try to age match the recipient to the donor if possible. So if your donor is about 40, we look for somebody who's about 40. But we don't necessarily exclude somebody who's not that age. You have to be healthy. You can't have diabetes. You can't have high blood pressure. You can't have had cancer in the last few years. And if you are interested, it starts with a phone call to a coordinator. This is a nurse who works for Clarion, and she does a review over the phone. She sees if you're healthy, if you're appropriate age, and she tries to rule out things that could rule you out as a donor. And then after that, you go through a series of tests. We make sure you have 2 kidneys. You don't want to take one out if you only got one. We make sure that you're not being compelled to do this, that you're not selling your kidney. You see a nurse coordinator. You see a transplant nephrologist like myself. You talk to the surgeon who will be your surgeon. And you see a psychologist to make sure, again, there's no undue pressure being put on you to donate this kidney. You also have available to you what's called a donor advocate. And this is somebody who's not directly associated with the donation procedure, and you can talk to them about questions you have, issues you may have. There are people who are healthy who may not be able to donate a kidney. Now, that can be somebody who, for instance, has blood pressure problems. Maybe they're on one blood pressure pill and their pressure is fine, but we still wouldn't take a kidney from that person. Maybe a person has kidney stones. We don't want to take a kidney from somebody who may have kidney trouble down the road, so that maybe someday they would be on dialysis or they would have a transplant. We do, I think, a good job here to make sure that there's no special issue that could crop up later in a person's kidney.